Hi, my name is Ziemianin. I'm part of Elmhurst University's nursing program. I'm going to be performing a reproductive and breast interview questions with you, okay?
Okay.
Could I get your name and date of birth? Bless
Sorry.
you.
Sorry. It's Jane Doe, January 1st, 2001.
Perfect. Do you have a preferred name that you go by that isn't Jane?
Just call me Jane.
Okay. What are your preferred pronouns?
She, her.
She, her? Okay. Um, let's see. And no, never mind. Sorry. Um, I'm going to move on to some questions going over, breast exam, breast health, things like that. Do you have any lumps or thickening in the breast or axilla?
No.
Okay. Any nipple discharge or recent inversion of the nipple?
No.
Any skin changes?
No.
Okay. Any asymmetry?
No.
So one being bigger than the other or like different than the other?
No.
Okay. Previously diagnosed with fibrocystic breasts?
No.
Do you have any risk factors for breast cancer, such as um, like menstruation, beginning before the age of 12, and then the others don't really apply.
My grandma had breast cancer, but I don't know
Okay.
if that.
Um, yeah, I think that's later. Um, have you ever had a mammogram?
Yes.
Okay. When did you last have that, and how often do you have that?
I think I just had my first one last year.
Okay. And then no significant findings or anything? Okay.
That's normal.
Any previous breast surgery or biopsy?
No.
And have you previously been diagnosed with breast cancer?
No.
Okay. I'm going to continue on to just some reproductive health questions. Um, when was the last date of your menstrual period?
Currently.
Okay. And what's the frequency, regularity, and duration?
Well, I have an IUD, so I don't really get much of a period. I get like maybe a day or two of just spotting.
Okay.
But I would say like every like 30 to 35 days.
Okay. And then so you say you have some spotting. Do you ever have any cramps or clots or anything else like that?
Um, Cramps usually yes, and I get headaches as well with it.
Okay.
Sometimes clotting, but not really.
Okay. Do you have any symptoms prior to menstruation that show up? So such
Um,
things can be like fluid retention, bloating, weight gain, mood cycles, breast tenderness.
I definitely bloat. I think I can be moody. I get cramps usually a couple days before, and I get like neck stiffness.
Okay,
That's usually how I know.
gotcha. Um, let's see. What was the age of your first menstrual period?
12.
12. Um, and what is your sex assigned at birth?
Female.
Yeah, okay. What is your gender identity?
Woman.
And what is your gender expression?
Woman.
And then sexual orientation?
Straight.
Um, what are your sexual patterns? So, what is your how many sexual partners do you have? Are they all male or female, or both? And frequency as well. And
Just
then if any are uncomfortable, you don't have to answer them as well.
okay. Just one, and a couple times a week.
Okay. Let's see. Have you ever been pregnant?
No.
Okay. What was the last date of a pap smear, if you've ever had one?
I think I just had one last year,
Okay.
last summer.
And what were the results of that?
Normal.
Okay. Are you planning to get another one in the future?
Ideally, yeah.
Okay. How often?
I think you do them every 2 years.
Okay. Do you have any hepatitis or HPV vaccines?
Yeah, I have the The one that's Gardasil.
Okay. And then when did you get that?
I think it was like 15.
Okay. What's your current level of prevention when it comes to sexually transmitted infections?
What do you mean?
So like what measures do you take?
I have an IUD,
Okay.
but
For sexually transmitted infections though?
I mean, as far as contraception, but I get tested and
Okay.
same partner.
Do you use, oh, you said IED, or IUD for contraceptive measures. All right, continuing on, and some of these might be a little bit more personal of questions. Um, so if any are uncomfortable, just let me know. Do you ever have any symptoms of vaginal discharge?
I mean, nothing abnormal.
Okay. What does that mean for you?
Like, yes, but it's not like a yeast infection. It's not
Okay.
anything like that. It's just normal.
Do you ever have lesions, pain, or swelling in the vaginal area? Any vaginal itching,
No,
pain during intercourse?
no.
And then you said you're not in menopause. Any difficulty conceiving a child?
I've never tried.
Okay. Um, do you ever have any incontinence? So like going to the bathroom on accident, like have an accident like that?
No.
Um, do you ever have any issues with urination, whether it be like going too much or feeling like you need to go immediately or you're going to like have an accident, burning when you pee?
No.
Okay. Um, have you ever had a urinary tract infection?
Yes.
When was the last time and how often do you have them?
They used to be a lot more frequent. I think the last time I had one was 2023.
Okay.
And then before that, I'd say like maybe one or two a year.
1 or 2 a year?
Yeah, they
Okay.
were pretty frequent before, but I haven't had one, at least not that I know of since.
Okay. Have you previously been diagnosed with a health condition such as an STI or cancer of the reproductive organs?
No.
Okay. Any previous surgery of the reproductive organs?
No.
Okay.
Just I know that IUD is technically a procedure, but no surgery.
Gotcha. And that is actually all for my questions. Thank you so much.